Well, hello everybody. Jay Michaels from the WEBE Wake Up Morning Show, and we are here for a WEBE108 store tour. And today we are touring a very special place, ENT Sinus and Allergy Center. We're in Norwalk, 761 Main Avenue, right on Route 7 in Norwalk. And I have right with me, next to me here, Dr. Rob Weiss. Hello, okay. Rob. How are you?
Thanks for coming.
Well, this is a terrific facility you have here.
Thank you.
Let's just, in general terms, talk about what you do here at ENT.
So we do a lot of things that are related to ENT, ear, nose, and throat. But we really specialize in allergies, sinus problems, hearing loss, balance problems. We kind of full spectrum.
Well, we were just talking about we are in season as far as allergies are concerned, and you have a little meter over here.
Yeah, the pollen count has been up all week. It's in the double digits, and it dropped a little bit down today because of the rain, but it's going to be right back up to 11 tomorrow.
I have to have a feeling that the phone's been ringing a little bit more.
Yeah, we've been busy. It's been a very busy season, and it kind of snuck up on us this year because we had the late snow, and everyone thought, well, we can't have allergies with snow on the ground, but the trees don't think that.
No.
They started blooming.
Boy, a couple of warm days and everything just starts to come
exploding,
out. Yeah.
So.
Now we are in a special designated room for a procedure that we'd like to talk about.
Right. So as part of our treatment options, we offer in-office balloon sinus dilation, and this is mainly for patients that have either chronic or recurrent sinusitis. So these are patients that can frequently suffer year-round recurrent infections. They get antibiotic after antibiotic. Nasal spray after nasal spray, and they just keep kind of going around the merry-go-round with this, and they never really get the cure that they need.
Right.
We end up seeing these patients.
Right.
We diagnose them as having this problem, and really all it comes down to is a simple procedure to use a ballooned catheter to gently open and dilate the sinus drainage pathways. And that usually takes care of the problem.
And how quick is that procedure? It's a simple procedure?
Simple procedure because we do it in office under local anesthesia, and it usually takes about 30 minutes.
Wow, that's not too bad at all. And what percentage of people come and have this serious problem where they would require or could take advantage of this procedure? It's
hard to put a percentage on it because we see all sorts of patients in here, but we're doing this almost every week. So we've built up a fairly broad patient base for this, and because we've been doing it since 2010, and we've kind of built our reputation on it.
So it's an in-office procedure, and it's the balloon sinuplasty procedure.
Right.
And I'm sure you have a website. People could probably even go.
Oh yeah, so we've got a lot of information on our website. It's www.ct-ent.com.
Wow. Dr. Robert Weiss from ENT Sinus and Allergy Center. Thank you so much for sharing your information with us.
Appreciate you. Thanks.
All right. Right now, we're in the room next door. This is the allergy room. A lot goes on here. And with me is nurse practitioner, Dr. Michelle Leonard. Hello, doctor.
Hi, good morning. Nice to meet you.
It's so good to be here at this facility. We were talking about allergies and about how it's become such an expensive problem in this country in terms of, what did we talk about, $20 billion a year?
Yes, over $20 billion a year.
Unbelievable.
It affects 30 to 40%, up to 40% of the population.
Absolutely.
In certain areas.
People come in here for allergy relief, and you've got a lot of great technologies that are on the cutting edge. And here's one right here with the screen. Let's talk about this flexible scope that we spoke about a few moments ago.
Well, this is what we pride ourselves in ENT, ear, nose, and throat, is our ability to examine the ear, nose, and throat. One of the ways we do that is with it's called a flexible laryngoscopy or a flexible scope. It's very easy. We do it to babies on up. All age groups.
Really?
Yes, we have a smaller one for children.
Wow.
As you can see, I'll just highlight my hand. Look at how fine you can see the fingerprint ring. And this way we can visualize, and the patient can see too on the screen, the nasal anatomy, the throat.
So this actually, the flexible scope, you insert this in the nose and it very comfortably goes up the nasal passage and allows you to see not only the nasal passage, but the ear canal and the throat, and you get a kind of an overview of how everything's related, correct?
The nose, yes, you can see the entrance to the eustachian tube and the throat, and we get an overall, and allergy patients have a certain look to their anatomy, and it's very easy to see and to point out, and And patients sort of go wide-eyed and they go, yeah, that makes sense.
Wow. And it's not an uncomfortable procedure?
No, it's not. We very comfortable in the chair. It's easy to do in any exam room chair.
Wow.
Yeah.
Well, the great thing about that is you can make an accurate and fairly quick diagnosis, correct?
Yes, we can do that.
Fantastic.
Yeah,
Doctor,
it's a lot of fun. It's a lot of fun.
Very nice seeing that demonstration. I was almost going to have enough bravery to let you do it on me, but we'll pass for that. But people, certainly another thing on your website people can click into and get more information about, right?
Yes.
All right. Well, this is the allergy room, and we're going to talk about and see the allergy drops, this new procedure that, instead of taking the shots, you take drops. We'll have more on that in just a moment. Well, right now, next to me is Maureen, and she kind of runs the allergy room. This is the allergy room, and behind Maureen and myself are these little capsules, these little containers that have allergy drops. And first of all, Maureen, it's nice to see you.
Nice meeting you. Thank you.
You see a lot of patients, and let's talk about, normally you think about allergy shots.
Correct.
But things have been changing in the industry, haven't they?
Yes, the more modern approach these days is, especially for New England, our busy patients and our young clientele who just don't like needles or don't have the time to come in weekly for shots.
Well, let's stop right there. You mean allergy shots are something you have to come in reliably every week?
Every week for at least a year.
Wow.
So that takes time out of your schedule. Most people are working full time, going on lovely trips to Florida.
Of course.
And children are in school. It's very hard for them to come in. So we have drops. So we first do our testing, and we get to see what we're sensitive to. That's indigenous to New England. So we test for grass, mold, animal dander, tree pollen, which we have a ton of in New England, and then we also have a lot of weeds as well.
A lot of weeds, yeah. So there's a lot of contributing factors, and everybody's different in terms of what they're sensitive to.
Absolutely. We do a dual portion of a test. We do the skin scratch test on the forearms, and then we like to kind of see what happens in a controlled setting if we introduce a little bit more of that antigen, that allergy maker.
Right.
So some people just have a negative skin test and they go undiagnosed for years. And they come and see me and they're suffering so long for 60 years, like nasal congestion, headaches, they're just miserable in general. They have to miss work or even GI problems, gastrointestinal something. So we find out exactly a lot of answers when you come and see me for the allergy test. You leave and you have a whole idea of what's going on with you, why you're suffering. So when we find that answer out, we make a formula. We put all of those pesky little allergy makers into this bottle.
Wow.
We give a very, very low dose when we first start. So we want to kind of introduce them slowly. Over time, you'll build up a tolerance where you don't need medication and you don't have to take time off of work.
Sounds like a little bit, and correct me if I'm wrong, like a flu shot?
It's a little bit like an allergy vaccine, some people say. So you don't have to... you don't have to eliminate like your cat or dog or live in a bubble. You can slowly build up your tolerance. Well, it's really nice.
Once you have the right solution, the drops.
Yep.
How are they taken? Does a patient have to come back here, or do they take the drops home with them? And how often do they have to take them?
Great question. So the first time when we get the bottle in the mail, the patient will come and they'll sit with me for 30 minutes. They'll take the drop under the tongue. It goes right under the tongue, one drop. You'll take a total of 3 drops a day.
Wow.
But the first drop, you'll sit with me for half an hour. We can hang out, talk.
Right.
And then if everything is fine, you go home, you take your drops every day. And every 3 months we want to evaluate, see how you're doing. And then every 3 months we'll slowly build up your dose a little bit more so that you feel better. Even after the second bottle, people start feeling relief. So it's amazing. Within about a matter of 6 months, people are starting to report such a relief, and then their medication use is down, their office visits to doctors are down.
Wow.
Their just quality of life is so much better.
Wow. Look, if you can put a thermometer under the tongue, you can certainly put a drop under the tongue.
Very good.
Sounds to me like it's pretty simple.
Exactly.
And user-friendly, and certainly, if you are someone who has an allergy, use the drops. You travel a lot, you can't... you just take it with you and you're all set to go.
It's absolutely appropriate for our busy clientele and our needle-phobic patients as well. So it's perfect. It really is almost equivalent to getting those shots every week. And who wants to get shots?
Who wants shots? Come on. Maureen, thank you so much. We have learned so much here today in Norwalk at CT, ENT, Sinus and Allergy. Again, on Route 7 in Norwalk, and we certainly hope you've learned something today. There are a lot of great treatments that make living with allergies a lot easier.